Morning, you guys. It is time for your health check. Hey, I was just having this conversation earlier this week. Do you drink diet sodas because you think that they're perhaps better for you? That might not be the case. Check it out. A New York heart hospital study finds that people who regularly drink either sugary or artificially sweetened beverages have a higher risk of stroke and heart disease than those who avoid them. But drinking diet versions really does nothing to lower those risks. Needless to say, the beverage industry is not on board. It says past studies dispute these new findings. Okay, we all know coronavirus cases are surging both in the state of Texas as well as across the country, especially among people in their 20s and 30s. How bad could this really be? Let's check it out.
Coronavirus cases are on the way back up in Texas, which is not a great sign heading into winter, but experts say this second surge may not be as bad as the first. Let's connect the dots. The summer coronavirus cases exploded in the Lone Star State. In some regions like Houston and the Rio Grande Valley, ICU beds filled up fast and healthcare officials struggled to keep up. Starting in August, those cases started to fall. The hospital stabilized and a lot of leaders breathed a sigh of relief, but it looks like that relief won't last. Cases in Texas are starting to creep back up, and so are hospitalizations for COVID-19. While that is worrying for medical experts as we head into the cold and flu season, there are some differences this time around. First, we know more, not just about how to treat people with coronavirus, but how to stop its spread. Another helpful difference is who is getting infected this time around. According to Dr. James McDavid at Baylor College of Medicine, the majority of these new cases are people in their 20s and 30s. That age group tends to do better against COVID-19, meaning less of a strain on our healthcare system in general. But experts do warn if we let our guard down, this modest surge could become much worse.
And don't fool yourself, people. You can get COVID-19 twice. In fact, I've talked to a couple of people who've experienced this. Hopefully we can chat more with them when they feel better right here on Daybreak. Finally, with several potential COVID-19 vaccines in late-stage clinical trials, what would a vaccine actually do to stem the pandemic? Dr. Anthony Fauci explains that vaccines would prevent symptoms in those who become infected with the coronavirus, but they would not kill the virus itself. Now, the bright side here is with reduced severe symptoms, coronavirus would pose a lower threat.